So far, the direst predictions for the adverse consequences have not materialized, and I don't believe they will.
And a new Kaiser study finding lower than expected premiums under the health care law. We're looking at my premiums, but anyway. Do protesters on both sides of the aisle have health care all wrong? Betsy McCaughey says, not a chance. All right, to hear Bill Clinton tell it, we're getting only all this awful news that's just wrong.
Well, the rates are out from 13 states, and in those 13 states, premiums are up 24%. On average, and the average really masks some of the big increases.
Maybe he was just talking about the other 37.
Oh, must be.
I have no idea. It's a horrible impression.
59% in Connecticut, 51% in California.
From when? From when the law was enacted?
Yes, from what individuals would have paid before the law was passed. In Wisconsin, the state insurance commissioner just announced that he expects premiums to be up 125%. But
wasn't Clinton saying that they'd be up a heck of a lot more without this as well? Well,
that's not true because, in fact, healthcare inflation has been the slowest in 30 years. There are three reasons why these premiums are going up. They include $100 billion in new federal taxes over the next decade. Secondly, the law requires you to buy things, certain types of coverage, whether you need it or not. The 45-year-old couple who must pay for maternity coverage is an example. And, of course, community rating, which means that healthy people are paying to cover the costs of very, very sick people who otherwise would be in a high-risk pool.
But isn't he saying that when all this settles down, and it will, when everything is running, no need to fear?
No. There are three strong reasons why premiums are being pushed up. I just explained them.
I know that, but we're talking about, he's saying the future, this isn't even in place yet, and people like Betsy are ripping it.
Well, the fact is, for
and he even
all
cited
that,
your name. Didn't invite you to the event.
For all that extra money, many people who buy these new Obamacare plans on the exchanges will have to give up the doctors and hospitals they currently prefer to use. For example, New Hampshire just revealed that the plan being offered on their exchange will cover only 14 of the 26 hospitals in that state because to keep premiums from spiking even more, insurers are paying rock-bottom prices to those hospitals and doctors, and most of the hospitals refuse to take Obamacare. Same thing in California, where Cedars-Sinai, the prestigious academic hospital in L.A., won't participate in any of the plans. So you'll have to drive by that hospital and go to the bargain basement hospital if you sign up for Obamacare.
Clearly the push is to focus on those who are getting something out of this versus the many more who you argue are not. Which wins out?
Let's do the calculation. According to the Congressional Budget Office, it's going to cost $1.4 trillion. That's $140 billion a year. They're going to cover 20 million people. That adds up to $7,000 per person newly covered. We could have just written them a check or bought them a plan and avoided all these tremendous negative impacts. For example, we're moving America from a full-time nation to part-time workers. 77% of the jobs created in the first 7 months of this year are part-time. That's a tremendous negative impact.
All right, Bill Clinton, you. I'm going to have to think about this. Betsy, thank you very, very much.
Welcome.
All right, well, 15